All right, so can you see the presentation?
Yes po.
Okay, so like what I said, we shall have the orientation on the cerebrum. So the cerebrum is one of the supratentorial structures that we have introduced to you in neuroanatomy. So it's the seat of the higher functions of the central nervous system. Now, as you can see here, the cerebrum is divided into two cerebral hemispheres by a very deep longitudinal fissure. So a fissure is actually a depression or a groove that is very deep, which is in contrast to a sulcus, which is a relatively shallower groove. So what you're seeing here is a deep longitudinal fissure that divides the brain or the cerebrum into the right and the left cerebral hemispheres. So this area, of course, is the anterior aspect of the cerebrum, while here would be the posterior aspect. Now let's view the cerebrum from the superior aspect. So we can see that the longitudinal fissure runs from the anterior part of the cerebrum all the way into the posterior part, where there's a bit of a gap between the two cerebral hemispheres, revealing now the superior portion of the cerebellum, which is located inferior to the cerebrum. So just to orient you again, right here would be the anterior aspect. This would be the posterior aspect, and the longitudinal fissure divides the cerebrum into the left cerebral hemisphere and the right cerebral hemisphere. Now let's view the cerebrum from the side or the lateral view. So what you're looking at here is the left cerebral hemisphere. So again, this would be the frontal aspect, whereas this would be the posterior aspect. Now, right away, there is a very prominent groove that divides the cerebrum into the frontal lobe and the parietal lobe. This is known as the central sulcus of Orlando, or you just can call it the central sulcus for short. And like what I said, this is very prominent on the lateral view. And just like what I said earlier, the central sulcus divides the cerebral hemisphere into the frontal lobe and the parietal lobe. Now, inferiorly, we would find what is called the lateral fissure. Some would call it the lateral fissure of Sylvius, lateral Sylvian fissure. Those are the same names for this particular fissure. Now, this lateral fissure divides again the cerebrum into the frontal parietal lobe from the temporal lobe inferiorly. So, in other words, the temporal lobe is separated from both the frontal lobe and the parietal lobe by the lateral Sylvian fissure. Now, inferiorly, there's a hint of a division between the parietal lobe and the occipital lobe. This is what we call the parieto-occipital sulcus. And of course, this separates the parietal lobe from the occipital lobe. Now, this parieto-occipital sulcus is not that prominent on the lateral view, but as you will see later on, this parieto-occipital sulcus is very prominent when we view the cerebrum from the medial aspect. Okay, so let's recap. On the lateral view, we can see now the four lobes of the cerebral hemisphere. First would be the frontal lobe, separated from the parietal lobe by the central sulcus of Rolando. And then there's the lateral fissure that separates the temporal lobe from both the frontal lobe and the parietal lobe. And finally, on the posterior part of the cerebrum, there is the occipital lobe separated from the parietal lobe by the parieto-occipital sulcus. Now let's take a look at the details of the lateral view, and let's take a look at some of the structures that can be seen here on the lateral view. Okay, let's start first with the fissure that we are looking at here, the one that is viewed in white. What is that again? Anyone?
Lateral fissure.
That's good. That's correct. Okay, so we can see here the four lobes that are seen on the lateral view. Labeled as number one is the frontal lobe. Labeled number two is the parietal lobe. What separates the frontal lobe from the parietal lobe? That would be the blank. What do you think is the answer? Very good. What about number three? What is this lobe?
Temporal.
Very good. And what separates the temporal lobe from the frontal lobe and the parietal lobe?
Lateral fissure.
Lateral fissure. And finally, posteriorly, we have a glimpse here of this tiny lobe. What do we call that lobe? Anyone?
Occipital.
Okay, very good. And what separates the occipital lobe from the parietal lobe?
Parieto-occipital fissure.
Very
Ay,
good.
tama.
Sulcus, parieto-occipital sulcus, right here. Okay, now let's take a look at some of the details that can be seen on the lateral view. Let's use the central sulcus of Rolando as our landmark. Now, immediately anterior to the central sulcus of Rolando is this very important gyrus. We call it the pre-central gyrus. Well, the name makes sense because it is located just anterior to the central sulcus of Rolando. Now, immediately posterior to the central sulcus of Rolando is the post-central gyrus, which is part of the parietal lobe. Let's recap that. We have here the central sulcus of Rolando, and immediately anterior to this is an important gyrus known as the pre-central gyrus, which is, of course, part of the frontal lobe. And immediately posterior to the central sulcus of Rolando is the post-central gyrus, which is part of the parietal lobe. Now, the precentral gyrus can also be referred to as Brodmann area number 4 if we're going to use the Brodmann area as a means of classifying the different gyrus. So let me repeat. The precentral gyrus can also be referred to as Brodmann area number 4 if we're going to use the Brodmann area of classification. Functionally, it is also referred to as the primary motor area. So the precentral gyrus functionally is the primary motor area. It is referred to as such because it is responsible for conscious control of your skeletal muscles. Thus, you're able to flex your biceps or extend your triceps or able to stand on your legs because of the conscious control provided by the precentral gyrus. As a matter of fact, if you have a lesion in this particular area, this will result to paralysis of the part of the body that is controlled by the precentral gyrus. Don't worry, we'll have more of that as we discuss clinical correlation soon. Now, what about the post-central gyrus? This is also referred to as Brodmann area 312 if we're going to use the Brodmann area of classification. Functionally, it can also be called the primary somatosensory area. Now, this is because sensory information such as the ability to sense your sense of touch, your vibratory sense, your sense of pain, among other things, all terminate in this part of the brain. So you're able to feel pain because that sensation terminates into this particular area. You're able to feel touch because that sensation also terminates into this part of the brain. Okay, so this is another view provided in this picture that shows you the important structures that we have seen earlier. Our landmark here, as always, is the central sulcus of Orlando. Immediately anterior to that, you would find the precentral gyrus, which is part of the frontal lobe. Now, separating the precentral gyrus from the rest of the frontal lobe is what we call the precentral sulcus. Now, remember, pag may gyrus, usually may kalakip yan na sulcus. So anterior to the precentral gyrus is the precentral sulcus that separates the precentral gyrus from the rest of the frontal lobe. Okay, on the other hand, posterior to the central sulcus is the post-central gyrus, which is part of the parietal lobe. And separating the post-central gyrus from the rest of the parietal lobe is this groove, shallow groove, called the post-central sulcus. Now, let's focus our attention now on the frontal lobe. So earlier, the gyrus that we have studied that is part of the frontal lobe is this precentral gyrus. Now, it is separated from the rest of the frontal lobe by this precentral sulcus. But what about the rest of the frontal lobe? We can divide the rest of the frontal lobe into the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus. What separates the superior frontal gyrus from the middle frontal gyrus? You will see a more or less horizontal line or a sulcus that separates the superior from the middle frontal gyrus. This is referred to as the superior frontal sulcus. On the other hand, the inferior frontal sulcus, right here, separates the middle frontal gyrus from the inferior frontal gyrus. Okay, so far, what are the gyri that we have seen that are located on the frontal lobe? The first one we have mentioned earlier is the precentral gyrus, located anterior to the central sulcus of Orlando. This precentral gyrus is separated from the rest of the parietal lobe by a narrow sulcus called the precentral sulcus. The rest of the frontal lobe is divided into the superior frontal gyrus, the middle frontal gyrus, and the inferior frontal gyrus. This and this gyri are separated from each other by the superior frontal sulcus, while the middle and the inferior frontal gyrus are separated from each other by this. We call it the inferior frontal sulcus. Now let's focus our discussion on the inferior frontal gyrus. There are three areas here that are very important. This is referred to as the orbital gyrus, the triangular gyrus, and the opercular gyrus. The orbital and the triangular gyri are separated from each other by this anterior ramus, called anterior ramus because, well, nasa harap siya. And the triangular and opercular gyri are separated from each other by what we call the ascending ramus. Well, the name makes sense because, as you can see, paakyat siya, kaya siya tinawag na ascending ramus. It is here on the orbital, triangular, and opercular where we can find what we refer to as the Broca center, the primary speech motor area. Or if we're going to use the Brodmann area classification, this is referred to as Brodmann area 44 and 45. This area of the brain allows you to produce spoken speech, repetitive. So this is the part of the brain allows you to speak, to create phonation, allows you to speak. Okay, so if there is a lesion in this area, there would be inability to produce spoken language. Okay, now let's focus our discussion now on the parietal lobe. So as always, our landmark would be the central sulcus of Orlando. This is the frontal lobe, and this is the parietal lobe. And immediately posterior to the central sulcus of Orlando is the post-central gyrus, which is separated from the rest of the parietal lobe by this post-central sulcus. It's almost like analogous to the structures that you see on the frontal lobe. However, for the rest of the parietal lobe, we would only see only two parietal lobules, the superior parietal lobule and the inferior parietal lobule. So let me repeat, there are only two parietal lobules that are located posterior to the post-central gyrus, the superior parietal lobule and the inferior parietal lobule, separated from each other by the intraparietal sulcus. This is another view that shows you the lateral view of the left hemisphere with emphasis on the structures that can be seen on the parietal lobe. Our landmark, as always, would be the central sulcus of Orlando. And of course, this is the lateral Sylvian fissure. And this is the post-central gyrus, post-central sulcus. And of course, what you're seeing here is the inferior parietal lobe. Now, if we follow the lateral Sylvian fissure, just above that is what we call the supramarginal gyrus. Supramarginal gyrus. It's like a smile, and you follow the edges of your mouth when you're smiling. That would be the supramarginal gyrus. And inferior to that and adjacent to it would be the angular gyrus. Clinically, this area that is found on the parietal lobe is very important because it is here where you're going to find the primary receptive area for speech, otherwise referred to as Brodmann area number 22. Or this can also be called the Wernicke's area. Wernicke's, if you are using English language, but if you prefer German, it can be pronounced as Wernicke. Okay, so the Wernicke area or Brodmann area number 22. This is the receptive area for speech. You're able to understand a language because of this part of the brain. So for example, pag may discussion sa biochem at wala kang naintindihan, meron ka ng excuse. Ang tawag doon ay Wernicke's aphasia. Wernicke's aphasia. If there's a lesion in this area, in the dominant hemisphere, what you would be suffering from what we call the Wernicke's aphasia. Okay, now let's move our discussion now to the temporal lobe. So our landmark would be here, the lateral Sylvian fissure. And the temporal lobe is divided into three gyrus, just like the frontal lobe. There's the superior temporal gyrus and the middle temporal gyrus. And finally, inferiorly, you would find the inferior temporal gyrus. What separates the superior temporal gyrus from the middle temporal gyrus would be this superior temporal sulcus. And of course, what separates the middle temporal gyrus from the inferior temporal gyrus is this, the inferior temporal sulcus. Now, finally, let's focus on the posterior aspect of the brain, and that would be the occipital lobe. We only see a glimpse of the occipital lobe on the lateral view, and it is better seen on the medial view of the brain. So what separates the occipital lobe from the parietal lobe? We have already mentioned this earlier. This is called the parieto-occipital sulcus. Let's take a look at the medial view of the cerebrum now. Now, as you can see from this one, the sulcus and the gyrus that were very prominent on the lateral view are not going to be as prominent on the medial view. Well, just to orient you, this would be the frontal, sorry, not the frontal, but the anterior aspect. This would be the posterior aspect. So what you're looking at here would be the left cerebral hemisphere, the medial view. Of course, we all know that this is half of the cerebellum. This would be the brainstem. Now, one important structure that you have to look for on the medial view is this. This is called the corpus callosum. This is the structure that connects the left from the right cerebral hemispheres. So the two cerebral hemispheres are capable of communicating with each other because of this corpus callosum. We'll have more of the corpus callosum in a little while. Let's start our discussion from the top. Remember the central sulcus of Rolando that is very prominent on the lateral view? Well, it can only be seen on the superior part of the cerebrum on the medial view. It doesn't cut all the way inferior. Hanggang topmost portion lang siya. This central sulcus on the medial view is surrounded by a U-shaped gyrus. We call it the paracentral lobule. Paracentral lobule is a U-shaped area that surrounds the central sulcus. The paracentral lobule is separated from the rest of the parietal lobe and the frontal lobe by this sulcus. We call it the marginal sulcus. And anteriorly, this is known as the paracentral sulcus. We'll go back to this marginal sulcus in a little while. Now, let's go back to the corpus callosum. Right above the corpus callosum is this gyrus. We call this gyrus the cingulate gyrus. So it lies on top of the corpus callosum. Now, this cingulate gyrus is separated from the medial frontal gyrus right here by this shallow groove. We call it the cingulate sulcus. It doesn't really have a label in this particular slide, but just above the cingulate gyrus is the cingulate sulcus that separates the cingulate gyrus from the medial frontal gyrus. If we follow this cingulate sulcus all the way to the top, it is actually continuous with the marginal sulcus. Some would even say that the marginal sulcus right here is the posterior termination of the cingulate gyrus. Okay, now what about for the structures located on the parietal lobe? Well, there is a sulcus that we have mentioned earlier in the lateral view that is called the parieto-occipital sulcus that is not really that prominent on the lateral view, but is very prominent on the medial view. This sulcus divides the parietal lobe from the occipital lobe. This part of the parietal lobe, which lies between the marginal sulcus and the parieto-occipital sulcus, is what we call the precuneus. Now, what about the structures located on the occipital lobe, which lies posterior to the parieto-occipital sulcus. So this is the occipital lobe. There is a shallow sulcus located inferiorly. This is called the calcarine sulcus. There is a triangular area between the parieto-occipital sulcus and the calcarine sulcus. This triangular area is known as the conus. So it makes sense. This is conus. The area before it is preconus. And finally, we have here the lingual gyrus, which lies inferior to the calcarine sulcus. Okay, let's go back now to the corpus callosum that we have mentioned earlier. So this is the corpus callosum. Its function is to allow communication between the left and the right cerebral hemisphere. It can actually be divided into the following parts. Posteriorly, this part of the corpus callosum is known as the splenium, which continues anteriorly into the trunk and then inferiorly into the rostrum. The angle where there's a change from the trunk to the rostrum is what we call the genu. So this is sort of like the knee of the corpus callosum, yung angle that separates the trunk from the rostrum. Now, we did mention this earlier. This gyrus located just above the corpus callosum is called the cingulate gyrus, and above it would be the cingulate sulcus. Now, separating the cingulate gyrus from the corpus callosum is what we call the callosal sulcus. So, in other words, the cingulate gyrus is sandwiched between two grooves, the callosal sulcus inferiorly and the cingulate sulcus superiorly. And as you know, the cingulate sulcus continues upward into what we call the marginal sulcus, which of course surrounds the area known as the paracentral lobule. Okay, so now we are looking at the inferior view. Binaliktad na natin yung brain. We're looking at the basal aspect of the brain. Just to orient you, this right here is the cerebellum, seen from below. And this would be the brainstem. So this would be the posterior aspect. This would be the cerebellum. This would be the brainstem. And here, the blood vessels you're seeing is part of the circle of Willis. This would be the anterior part. Okay, let's focus on the structures that can be seen on the frontal lobe. One of them is this. This is called the straight gyrus. It's not gay, it's not bi, it's straight. And why do we call it the straight gyrus? Because, well, in contrast to the other gyrus that are convoluted or kulot-kulot, ito lang yung kaisa-isang gyrus na derecho or straight. Immediately lateral to that is a depression. We call it the olfactory sulcus, called as such because the olfactory bulb is lodged within the olfactory sulcus. So laman niyang olfactory sulcus is the olfactory bulb which is natanggal na. And that olfactory bulb actually continues to become the olfactory tract. And lateral to the olfactory sulcus is the orbital sulcus. Okay, orbital sulcus, and right here would be the orbital gyrus. So this groove that separates the this area from this area is called the orbital sulcus, which bounds the area of the orbital gyrus. Okay, so now we're looking at the cerebrum from the inferior view. So para maintindihan nyo, the cerebellum here has been taken out. So you're looking at the inferior view of the cerebrum where the cerebellum here has been taken out. This is, of course, the occipital lobe, and the frontal lobe has been resected out to reveal the parts that you are supposed to see here. Now, adjacent to the brainstem right here is this hook-like area. This is called the uncus. If you've heard of the uncal herniation, wherein if there's increase in intracranial pressure, this uncus is the one that herniates into the foramen magnum, which is a lethal condition. Ito yung bumababa sa foramen magnum pag mataas masyado ang intracranial pressure. We call it the uncus. Lateral to that is a gyrus. We call it the parahippocampal gyrus, which is part of the limbic system that you have studied a few weeks ago. Bounded laterally by a narrow groove, we call it the collateral sulcus. And lateral to the collateral sulcus is the lateral occipito-temporal gyrus. Okay, and then we have here the occipito-temporal sulcus, and in between you would find the lateral occipito-temporal gyrus. Okay, finally, if we follow the parahippocampal gyrus right here, posteriorly and inferiorly, it continues into what we call the medial occipito-temporal gyrus. Okay, so that is the end of our orientation for today. So I hope you're able to follow, and you just need to have a bit of practice to master this. So do you have any questions?